What does good cancer care look like? Treatment for cancer is complex, and the physical and psychological impacts are more complex still. Good cancer care, therefore, is care that takes a holistic approach to your treatment, both during and especially after the treatment has ended. Good cancer care is care that keeps you fully informed of all developments during and after your treatment. And good cancer care is care that is timely with minimal delays. Good cancer care, therefore, should start with yourself, being aware of any changes in your body and seeking help as soon as you can.
Hi, John Organ here. So, what does good head and neck cancer care look like? Well, to me, three things I'd like to say. The first one is empathy. It's your 9 to 5. I once said to a consultant, but this is my life. You talk over me and talk through me because of my speaking. But this is my life and you're 9 to 5. So empathy. The second one is mental health. When I asked for help, it wasn't there. How can you spend tens of thousands of pounds on surgery and radiotherapy and chemo? And send you back out into the world with no aftercare. Mental health needs to be looked at. And lastly, radiotherapy waiting room chairs. Can we have some relaxers or some lazy boy chairs or something? The last 10 sessions of radiotherapy, I slept in the waiting room, slept on the table, nice relaxing chairs. Those three things would make the world of difference. Thank you.
What does good head and neck cancer care look like? I'm Hazel. I'm 5 years post chemo and radiotherapy for HPV-driven cancer. Good cancer care looks like me. I'm happily living my life. I try to help others, whether they're in diagnosis, treatment or recovery. I ride my bike, I do my gardening and I live my life happily. Head and neck cancers matter.
Hi, my name's Jane and my husband unfortunately passed away December 2019 of head and neck cancer. I'd like to read a few extracts from his book that he wrote about his life before and with cancer. It was called Face Cancer. Chapter 15, My Strategy, Mind, Body and Soul. A support network is essential. I picture this as a triangle. All of your medical team are in one corner. In the other corner are your family and friends. And finally, in the last corner is you. You're not in the middle of the triangle, you're part of it. I firmly believe you need to help yourself too. When it comes down to it, it will be you in your bubble who will have to face up to it. And then I'd like to read a little extract that I wrote in John's book about well-being. Look after yourself is my top tip to any carer or family member. It's not just the patient who has to endure this, it's the entire family. My health, as well as my husband's health, was of utmost importance. How could I look after him if if my health took a decline? It takes time, love, understanding, consideration, compassion, and strength to plough on through the minefield that is cancer. With its diagnosis and treatment dropping like bombshells. At first, it seems an impossible task, but as time moves slowly forward, so do you. Take baby steps at first. It's not going to happen overnight, but try to allow your mind to take a break from the worry. Let yourself be free for at least part of your day, giving you time to reevaluate and subconsciously think. Decide what you enjoy most and find something that fits in with your schedule, whether it's going for a swim, a facial, a walk, a haircut, or a drink with friends. Use any free time wisely and enjoy it. A natural reaction to this is a feeling of guilt. Why should you be enjoying yourself if they, the patient, are in such pain and discomfort? It's only with time that you will get used to the idea of the mantra, look after the carer too.
So, good day. My name is Nigel Lloyd-Jones. I live in Cheltenham and I'm now 69. In October 2014, I was diagnosed with head and neck cancer at Gloucester Hospital following biopsy evidence of cancer in a neck lymph node. However, subsequent scans were unable to identify the primary tumour. Now, Gloucester's recommendation was a course of chemotherapy and surgical treatment with a full neck dissection. My family and I found that life-changing recommendation alarming, and we took a second opinion. And subsequently, I had 6 weeks of radiotherapy at the Royal Marsden under the supervision of Professor Chris Nutting, and was signed off in December 2018. And I'm eternally grateful to everyone involved in my, so far, successful treatment. So, what does good head and neck cancer care look like? Now, every patient's situation is unique, so I can only speak from my and my wife Sheena's experience. I'm also conscious that approaches on care have evolved since my treatment. So for us, there are 3 key themes. The first is a compassionate, transparent engagement process. Now, the first days after diagnosis were a time of shock as we absorbed what this meant and the rapid adjustments that would have to be made to our working family life. Now, this included relocating to London during the treatment during the week for the treatment. So we needed a compassionate approach from our healthcare professionals as we adjusted to our new normality. We also needed transparency on what the treatment entailed and how this would pan out in the weeks and months ahead in order that we could prepare both mentally and practically. Now, I sense how far that transparency goes depends on the resilience of the personalities involved. Now, the second theme is caring for the carer focus. Now, I was extremely fortunate to be cared for by Sheena, but this was a frightening experience for her as she saw the rapid deterioration of my health, loss of weight, and all the gruesome side effects. Every day she wrestled with trying to provide me with nutrition when eating had become almost intolerable, and supervising the endless pain management medications. The saving grace was the accessibility of the Marsden Nutrition and Pain Management Support Team. And this included Kira Dillon, who was then clinical nurse specialist for the head and neck cancer team. The third theme is accessible, responsive aftercare in dealing with the long-term side effects. Now, an example for me was the problems I have and continue to have in swallowing. Now, this was initially alarming when going out to dinner, when one can't always monitor the suitability of the food being served. Now, in early episodes, I thought I was going to choke to death, but was saved by the intervention of friends. The Marsden then ran swallowing tests and demonstrated to me where the food was getting stuck, which was at the base of my tongue, and did not block my airway. Since then, if I choke, I try and relax, breathe through my nose, and then swallow hard until the blockage is cleared. So for us, good head and neck cancer care looks like a compassionate, transparent engagement process, a caring for the carer focus, and accessible, responsible aftercare. Now, I hope this has been helpful, and thank you for everything that you're doing.
Hi, my name is Toby Amis, and I was diagnosed with cancer on my vocal cords in early December 2021, and here's a little bit about my experience. after about 12 months of trying to work out why I had a husky voice, was it acid reflux, speech and language therapy, etc., we finally worked out via a biopsy that I had stage 1 cancer on my vocal cords, and we were all very thankful for catching it so early. I was then in radio literally a matter of 5 weeks later in early January. I had a high dose short form of radiotherapy, and I was out of radio by 15th of February, and then followed a really painful month where I found it extremely hard to swallow anything. In fact, I couldn't. I had to carry a bottle around with me to even spit into, which was horrible but necessary. But then rapidly kind of got over that phase and was back at work by April. Interestingly, ever since, and I've had lots of checks ever since with the great NHS, they've been amazing all the way through. I've had a check or a scan every 3 months, either an endoscopy or a scan. But I was warned actually that once you're over the physical side, the mental side starts to kick in, and lo and behold, that's what's happened. There's not a day that goes by without me thinking about whether it's going to come back. As you can probably hear at the moment, I've got a bit of a husky voice, so I'm sort of in heightened anxiety mode at the moment, and actually going to get it checked again and regularly. But every day I think about it, I'm constantly feeling my neck to see if I've got any lumps, if I've got any bumps, thinking about the quality of my voice. So yes, I would say that, it's something, it's my experience so far, it's not left me. I'm never really able to really relax and think that it's gone. Well, thus far I'm not anyway. Here's to the future, maybe that will happen. But as it stands today, no, there's not a day that goes past where I don't just think about it once. I think about it minute by minute, hour by hour, and it's exhausting. But it is what it is, and you just get through it in the ways that you can get through it. So yes, that's my story to date. Maybe there'll be more to come.
Hi there, my name is Laura. I'm also known as Biz, and I have a total vasectomy in August of 2019. What good head and neck cancer care looks like to me is being informed of as much as is possible. And this isn't just being given a system pairs document of the potential side effects that I'm never going to read. This is about having someone go through with me that system pairs document and explain what xerostomia is, or what my thyroid could be like, and what the outcome of my treatment path has been to be, so what the aim is. Not necessarily the exact, not exactly the exact end result, because they're not psychics, they don't know the perfect outcome, the full outcome, as everyone is different. But, if the perfect outcome is A, and the worst outcome is Z, you want to get into M? What is M? What does that look like? So, there's an alternate. There's neither good, there's neither worse, but tell me that they want to get into the middle and what that looks like. And tell me how I can help myself. Medical professionals, you are awesome. The things that you can do to help us patients get through our head and neck cancer is amazing, and to have a positive life is unbelievable. But what can I do to help? How can I do things before surgery, before treatment? Let me know. It's my body, this is my health, and it's my life, and I want to know what I can do to ensure that I have the best quality of life and work with you. So communication, clear and concise, information, the good, the bad, and the in between. And what I can do to help myself and to help you deliver the best outcome. That, for me, is what the head and neck cancer care is. One other thing, having that person or people, maybe two, who are your go-to, because you get to know them and they get to know you, you're intimate them and with them for a long time. 5 years, you know. They're your buddy, they're your friend. Let's know who they are. But yeah, thanks everyone. I hope this helps.